Hello, how are you? Just for a timestamp, we're now the 20th of August. So, what's been going on for you?
Hi Jane. Well, all sorts of stuff really. I don't know if you noticed I had a big webinar on the other evening. That was really good, talking about dental legal essentials. Been helping some individuals, doing lots of phone calls and doing a bit of gardening. How about you?
Well, I've been being creative as well. I've been making some smile masks. These masks. This is Mark 4 of my prototype. So masks that can be. You see your face through it. Obviously, they're not for use in the surgery. I've been foraging, making jam, and obviously just helping dentists that are calling, wanting to make some changes, answers, support. Yeah. So mirroring what you're doing, I think.
Yeah, I think that's right. One of the things we chatted about just briefly last week is we said these videos are becoming so popular. We're also going to do some podcasts as well.
Yeah, I know, it's exciting, isn't it?
So for those people, it's the first time they've seen us. Do you want to just take a minute or two to introduce yourself and say a bit more about what you do?
Yes, okay, thank you. So I'm Jane Laline. I'm an international business coach, trainer and mentor, and I still have a valid GDC number. I've got damp fingers. I wouldn't say I've got wet fingers, but I still do some treatment with patients, and one of my passions is the work that I do for Dentaid in the UK and abroad. But for dentists, it's not about practice management. For me, that phrase practice management is somehow very stagnant. It's about practice development. It's about improving, it's about growing, whether it's to do with the team, communication, the finances, the patient journey. And you'll know that one of my real passions is having a communication model, patient-centered sales best choices, where the patients are really getting what they want, the dentists are delivering the type of treatment that they love to do, and because we're focusing on the patients, the dentist's income goes up by accident. So it's that selling without selling. So that's a little bit of what I do, and I do some therapeutic stuff. So if people are traumatized, might be a medico-legal case, it might be that they've been sexually abused or just broken a file in a canal. There's trauma affects us in so many different ways. Phobias, fears, that sort of stuff, I enable people to get through on the other side. So a mixed bag, big mixed bag.
It is, isn't it? And everyone thinks if they're a dentist, you're just a dentist and you don't have other skills. And that's hugely valuable to show people how you can develop and build other skills. We've got a huge stomach for that. So what do I do? So I'm Sue Boynton, I'm a dentist, and I'm an independent dental-legal consultant. What I do is I help dentists and teams if they run into trouble, and that might be with complaints, with GDC, with claims, CQC, that sort of thing. And I spend the other half of my time doing lectures, webinars, conferences, helping people with risk management, with simple things that you do in the practice, effectively to keep out of trouble.
Yeah, and listening to what you say, I think that what the pair of us do in our different areas of unique skill sets and passion is that we work with our clients, helping them get out of whatever challenge problem they're in at the moment, and we also prevent it happening in the future. So whether preventing it so the crisis doesn't happen, or helping them through the crisis and then setting things up so it never happens again. So, yeah.
Yeah, that's it. And often that's the skill set, isn't it? It's unpicking what's happened. I sometimes describe it as being a little bit like a private detective, looking through things in different ways and working out what's gone on. How to stop it happening for that person, how to stop it happening for the team in the practice, and then is there a way of spreading that information around the profession as well?
Yeah, absolutely, because I think it sounds a bit bizarre. I think mistakes and near misses are actually really exciting. I don't bring them on, I don't create them, but I think they are exciting because there's an opportunity to learn and grow and excel, rather than just sweeping them under the carpet.
Yeah, I know what you mean. The other way of looking at it is, of course, for some people, it's really scary.
Yeah, I know.
It might be just a cusp dropped off or something
Yeah.
like that at the end of restoration. And they're so scared. Some people are almost paralysed by fear when something happens. They don't know what to do. And sometimes they don't know what to do and they don't ask anyone. So they don't do anything and they don't tell the patients about it either. So we're seeing this from lots of different perspectives. And I think you and I have a lot of those phone calls with people as well, picking, okay, this isn't the end of the world, we can help you sort it out.
So what sort of phone calls have you had this week then, Sue?
Do you know, it's people saying, something's happened in the surgery, and last week actually, not this week, somebody taken the wrong tooth out. It happens in dentistry, I've done it before. I know what it feels like when you've taken the wrong tooth out. It's that horrible stomach sinking feeling. And the first question is, am I going to get referred to the GDC? And if I do, am I going to get struck off? That's how scared people are. So I usually listen to what they've got to say. Okay, let's unpick this for a moment. What's happened? The wrong tooth's got out. Okay. Did you recognise it? Yeah. Did you stop? Yeah. Did you tell the patient? Yes. Are you going to put it right in one way or another? Can you put that tooth back? Or can you do something else to put them back in the position they would have been in? Can you give them an apology? Can you give them an explanation? And then can you look at why it's happened and introduce it into surgery so it doesn't happen again? And then tell the patient you've done that as well. If you do all that, often you won't believe it, you don't even get complaints, let alone anything going on with the GDC.
Excellent. Can I ask you to repeat that and punctuate it again, because I get many calls from dentists that are paralysed by fear. I was speaking with somebody the other day who was considering leaving the profession because she's so fearful of being sued and being struck off. And when I unpicked it, she'd never even had a verbal complaint against her. She'd never had anything. So can you, for the audience, say that again, what you said? Are they going to get struck off if they take the wrong tooth out, if they've done things properly?
Yeah, absolutely not. No, they're not. Chances are it's not even going to go to the GDC. If you're unlucky and it did go to the GDC and you've done all the right things, it's going to go away at a very early stage. You're not going to end up at a hearing or anything like that. And that's what everyone is worried about. That's the ultimate sanction, isn't it, going to the GDC? So if something goes wrong, people often get sort of a brain freeze about this. Something goes wrong in the surgery and you think, oh, I know what to do, and you think, no, I don't. Stop. Think. Even if you take 10 seconds thinking time, it seems a long time to you. It isn't to the patient at all. In fact, the US Marines are taught if something goes wrong and it's not life-threatening, stop and count to 10. Give you the thinking time, think what's happened, sit the patient up, get them at eye level, so you're building that rapport, you're getting a good communication, explain what's happened, apologise, tell them what you need to do to put it right, tell them what the significance is, and then either put it right yourself, or if it's something you can't do, give them a referral to put it right, and then follow it up and make sure it's sorted out. If you do all that, and you're a good communicator with your patients, and you show them that you care, they're not even going to make a complaint. They'll simply say, this dentist's human, but by Jove, they've put it right for me.
Okay. So I heard you say an if there.
Yeah.
You said if you're a good communicator and you really show that you care about your patients. So there are going to be some dentists and team members out there that don't know whether they are good communicators. They may be aware that they're not great communicators. So where do they go to improve their communication skills?
That's a really good question. And the first thing I would say to people is everybody benefits from communication skills training, however good you are. I don't mean about you, I go on it sometimes as well.
I'm always on it. I'm an NLP. I'm always on it, communication skills training.
In the olden days, when we could go to places, you could go to face-to-face training and small group training, or you could get trainers to come into practice. These are actually trainings that work quite well online as well. Look online for dental training communication skills, and sometimes some of the indemnity organisations run workshops on those as well that are very helpful. And I know you've got workshops on communication skills as well. I do it one-to-one with people. you don't lose out from doing it. The better communicator you are, the better relationship you have with patients, and the more successful you're likely to be.
Absolutely. Absolutely. I know we call ourselves the two wise birds, but sometimes I become so conscious that we almost have exactly the same voice. We come at these things from different angles, but maybe it's because we are, or certainly I speak for myself, I'm the purple side of 50. Referring to that poem, when I'm old I'm going to wear purple. I'm the purple side of 50. And it's experience, and communication is the absolute key to everything. It's the key to a harmonious team, harmonious relationships with your patients, harmonious relationships at home. And my understanding of communication, in part, is it's not about what we say. It's about what we hear and what the other person hears.
Absolutely. And I'd add to that as well what the other person understands.
Yeah.
Too,
Yeah.
once they've heard it.
Yeah.
You're absolutely right there. And now we've got a bit of free time in practices that we didn't want because we've got time. And it's time to practice things like that within teams as well.
Absolutely.
Practice answering difficult questions within your team.
Absolutely.
So everybody knows what the answer is,
Yeah. And I think that's, I was asking you about what sort of calls that you've had. I've had some calls this week from dentists who are really scared. One of which was about dealing with a patient who had never been to the practice before and has been hearing on the social media, hearing on the television that dentists are open, and is believing that it's situation normal.
Yeah.
By all accounts, the patient had COVID symptoms, and the dentist was saying, we're unable to see you. And to say that the patient was vocally unhappy, I think, is an understanding. So what's your take on that sort of stuff? Because this dentist is obviously fearful that she's going to get sued, because when the patient said, I expect you to jump, they didn't say how high.
Yeah.
They stuck to their guns. What's your response?
And isn't that awful when, as a profession and as individuals, we're trying our very best to do what we can? You're right, there's a huge amount of misinformation out there, some of it deliberate, some of it accidental, and of course different practices are at different stages of the development, depending on what they can do with the PPE, depending on the backlog of their own patients that they've got as well. It was perfectly okay for that dentist to risk assess this patient, and the minute it transpired that he sounds like he's got COVID symptoms, that's when you say stop. That's exactly the right thing to do. So that shows that practice has the right standard operating procedure and they've applied it in the right way. If that patient's horrid and he makes a complaint, either directly to the practice, or he goes to solicitors, or he goes to the GDC, that dentist defence organisation will be able to give her a robust defence. She'll have done all the right things, provided that she's also documented what she's done as well.
Okay, I think that's key, isn't it, about documentation, justification and documentation. So, and we've spoken about this before on a previous call about our SOPs, making sure that they are a live document and updating them and writing the justifications for why we've done what we have done or haven't done. Yeah.
Absolutely. Because don't forget, sometimes when you get complaints about these things, it might be 3 months or 6 months down the line. With an SOP, it's really important to have it dated or have a version control. So when you're looking back, you say, on that day, that was the SOP that we were using. Yeah.
And for people that don't know, again, I'm going to pick you up another little bit of lingo used there. What do you mean by version control?
Yeah. So you might start with your first standard operating procedure, and then some new guidance comes out, some new information comes out, and you think, oh, we need to change our operating procedure, numbers 1 to 9 are okay, but we need to change number 10, you will have a second version then where number 10 is different. You'll date it and put version 2. Version 2 changed on the 20th of August. Then something else happens on the 30th of August and you think, goodness me, we need to change it again. Version 3, 30th of August.
Okay.
It sounds a bit belt and braces, but it's really helpful when you're unpicking things. And I'm often on the other side of this, when I'm helping people with their defence and tracking something back to what's happened.
Yeah. So I agree with you, an absolutely invaluable safety net that with our. Yeah.
You're absolutely right. So you mentioned you get a lot of people on the phone thinking of giving up dentistry.
Yep.
Tell us a bit more about that, because I bet there's people listening who I think that's interesting for themselves or for somebody that they know.
Yeah. I have been receiving a lot of calls. My hesitation here is about thinking about how things have changed since the beginning of COVID. Because right at the beginning, the calls were about, well, this is an interesting opportunity. I think I might like to explore this concept. Now people are going back to work. They're just saying, I've got to leave for whatever reason. But when we've unpicked it, and found out what's going on that has meant that somebody has come up with this belief about what they need to do with their career, we found that in all but one exception, they are unfounded. And what I'm discovering is people will say, I need to leave the profession. But when they unpick it, what they're really saying is, I can't do dentistry in the way I was doing it previously. I can't, and that could be, I can't continue to see 30 patients a day. It could be that actually I recognise now that the practice is a toxic environment. And we all know that people don't leave a job, they leave a toxic environment, a toxic culture. It could be that they recognise that they don't find NHS dentistry fulfilling. It could be they're in a private practice and they're finding private practice overwhelming for whatever reason. But what I found really interesting is that what was initially presented as I think I need to, or I want to leave dentistry, it's not that. It's I need to do it differently. And it's been really exciting to realise that we're not going to have the exodus. And I do worry that people who do think that, oh, I'm going to leave, just make a knee-jerk reaction, give up their GDC number, give up their indemnity. Their indemnity is easier to get back than their GDC number. In a knee-jerk reaction, just go, that's it, I'm chucking it all away, and discover that the grass isn't greener on the other side. And so that opportunity to unpick and what's really going on is a great opportunity.
And it's interesting that you say that, because I'm getting the same sort of calls. I usually get them when either something's gone wrong or someone thinks something's going to go wrong if they continue doing the same things in the same way. And that's exactly it, is unpicking. Is it the patient? Is it the practice? Is it the environment? Is it the type of dentistry? Does somebody just need a break? Or is the fact that they've had a break that thing that's made them think about stuff differently?
Yeah.
I just simply can't carry on like this.
Yeah.
You mentioned getting your GDC registration back, and of course you need your GDC registration to get indemnity. So, although indemnity sometimes seems like it's easier to get back, you need to be on the register as well. And I can understand why people come off the register. And as you say, it's not always that easy to come back on. And people have come off it accidentally when they haven't paid the renewal fee on time or they haven't done the CPD declaration or whatever. They find it quite difficult to come back on and quite time consuming.
Yeah, absolutely. Yeah, and I had a heartbreaking story the other day with a lovely young dentist, overseas dentist, who in their undergraduate training had only ever done anterior endos.
Oh, wow.
And had stepped into an NHS practice and had their first molar endo had broken a file.
Yeah.
And as a result of that, that was coded as, I'm useless, I need to leave dentistry, which again, unpick it. No, it's okay, maybe there's some training involved here. And I know that at the moment, there is a debate going on about the GDC and registrants and overseas people. And I think that it's important that we all understand basic skill sets and learn,
absolutely.
always learn.
But if you think about when we qualified, and you're right, with the same sort of age group, we had to do a large amount of each individual procedure and get it signed off. The difficulty for newer graduates, it isn't that way, even in the UK. So whilst they might have done, I don't know, a handful of RCTs, that's not like you doing 30 or 50 RCTs. And I'd always say to young dentists, whether you're doing VT or FD or not, get into a practice where somebody's really good who will mentor you,
Absolutely.
who will show you things.
Absolutely.
You can watch them working.
Absolutely.
Not be able to do that at the moment, but when we get back to a bit more normal, and see how they communicate with patients, see how they set up the surgery, see how they do things, see how the nurse and the dentist communicate together, build your skills in that way.
Absolutely, and one of the things I always encourage clients to do is when they're taking teeth out, where possible, get consent to keep the tooth to use it for training. And so if somebody recognises they're not as good at endo as they could be, practice on those real teeth. Notice where the pulp chamber is, because there is a big difference between cutting a plastic tooth, whether it's endo or crown preps. There's a big difference between cutting a real tooth and cutting a plastic tooth. And yes, you need to have the paperwork. I know it sounds a bit crazy, but we do need the paperwork just to say that the patient's given us consent to do it.
Sure, and I was reading something the other day where somebody has developed something you can do with artificial intelligence, and it appears that you're drilling a tooth when you're not, and it has even different feelings when you go through enamel.
Oh, wow!
Chamber.
Oh, that's exciting.
I need to find that information and send it to you. It sounds really good for just that sort of reason.
Yeah, because it's that proprioception that is so important.
Yeah, absolutely. You know, if you've ever gone through a vocation, you know what that feels like.
Absolutely.
You probably don't do it again. So yes, these are all the things that are challenges for lots of dentists as well. And to somebody who suddenly realises that there's a gap in their skill set, that's not the end of your career. It's brilliant that you've recognised it. Do something about it.
Okay. So if we were going to do an overview, a summary of what we've been talking about for the last 15, 20 minutes, what would you say are the key takeaways that people must remember and share with the team?
Oh wow, what a good question. We talked about how really important communication is and managing patient expectations. Have the right SOP in place and follow it, have the paperwork for it, have the good records for what you do. If something goes wrong in practice, don't panic. Stop, explain, put it right, apologise, get some advice if you need to from your indemnity organisation. You'll be okay. Don't panic. If you get a letter from the GDC, it's not the end of the world. It's usually something that can be sorted out sooner rather than later.
Brilliant. Yeah, and I think my takeaways are actually things, although they seem bad, they're probably not as bad as they think they are. So actually, the chances of being sued and getting to an FTP hearing are actually slim if you handle it correctly, and that communication and self-reflection is at the root of it all, and we can make the most of the time that we've got available, fallow time, unbooked time, just to be training our team, engaging them, because your team are your eyes and ears.
Yeah, that's absolutely right. And be clear if we have to give one tip. I think it would be building rapport.
Yeah, absolutely. Okay. And can I just say something on that? And I know I've laboured this before, but I know that for many people, because I hear them giving me feedback, that they believe that building his rapport is about remembering when your patient's birthday is, remembering the name of their dog, right, and stuff like that. Now, rapport is a big subject, and I've recognised that the most powerful thing in rapport is matching and mirroring. We know this experientially because pretty much any of us can go into a restaurant and just look around a restaurant and know who's getting on and who's not getting on. Absolutely. We may not consciously know why, but it's because how closely do they match each other's body language? How closely do they match their tonality? How closely do they match their words? So people can look at the NLP match and mirroring. They can look at the Desmond Morris stuff, and he calls it a body echo. Yeah. And that's how we build a rapport where we start to become an echo to the patients because people like them. So yes, it's nice. It's the icing on the cake that you remember the name of their dog. Yeah. But please don't think that that's rapport, because if not.
I think that's a really good way of describing it and helping people to remember it. So I hope people have enjoyed this video, and it's also going to be
fantastic, and we'll see you all again soon. Take care.
See you soon.
Bye.